We'll try to get you a sense of the situation in the UK in just a moment. Remember, once again, speaking to Patrick Jolomba, who's a medical researcher in that country, given the fact that they've recorded over 93,000 infections in a single day, that surge being fueled by the Omicron variant. And on the back of that, the UK government is now thinking, or rather holding an emergency committee meeting to try chart a way forward. That meeting taking place this weekend. There's real concern, of course, around the capacity of the National Health Service there, as hospitalizations may actually coincide with staff falling ill, and that may stretch an already overstrained resource base. At the same time, France is also banning all non-essential travel from the UK today. Again, for those developments and more, Patrick Jolomba is live to us from just outside Birmingham in the United Kingdom. He's a medical researcher as well as a member of the Research Ethic Committee. Patrick, hopefully you can hear us a bit better now. What I'd asked initially is a question I'll repeat. What do you reckon ought to be the outcome of this emergency meeting that's currently being held by the UK government?
Again, I hope you do also can hear me. Can you?
Loud and clear, yeah, go ahead.
Fantastic. Good morning again. Yes, as I was saying earlier, I said it's slightly worrying, of course. The numbers are, really high. This is the worst it's been, since COVID started. Hopefully, the numbers of admissions in the hospitals won't be that high, but they are beginning to go up as well. It's really difficult to tell at this stage. So we don't know what's going to be the outcome of this meeting, but I certainly would not be surprised if they start thinking along the lines of, some kind of lockdown, maybe a couple of hours, so a couple of weeks lockdown, post Christmas. So really, the numbers cannot be ignored, going at this rate, at this level, certainly.
Yeah. There's an interesting phenomenon that, experts like yourself have taught me, at least in the past couple of days. It's called the decoupling of infections, deaths, and hospitalizations. If you've come across that term before, help us break down what that means and how that should inform what the government does in response to this pandemic.
Yeah, I think it's all about looking at, the total number of infections, going up, but also is literally planning ahead of what can potentially happen in terms of hospitalizations. Is the NHS, which is the National Health Service, is it ready, to deal with this? It's also looking at the capacity within, intensive care for any kind of, invasive therapies that, potentially this could lead to. So really, it's the total, to put it in a layman's term, or perhaps in a normal understanding, is to really understand the whole concept and the whole phenomena of the current sort of situation that we are in now, and to plan for it going forward. So really, quite basically, that's what that is.
There have been real concerns around how people actually feel about lockdown in the UK itself. Great debates taking place about whether or not it's necessary, given the economic fallout of a measure like that. If there were to be more curbs in the lead up to Christmas, what's your sense around how this will land with ordinary people in that country who've endured some devastating lockdowns, like many other people around the world, for months now?
I think you've seen the last couple of weeks since the Omicron variant was actually, announced as a variant of concern. We've seen queues and queues of people, wanting to get that sort of third dose or booster dose, so to speak. I think the message has gone in quite well to say, if you do get a booster dose, you really increase your chances of perhaps not really being sick or being hospitalized, and certainly not dying from this variant or from COVID, by up to 75%. We've seen that. So it shows you the community is completely worried. Their approach, or the approach, is certainly different from, a few months ago, when, people had to be urged to go and take the vaccine. So it's almost voluntary. People are queuing up to get these things. But also we know, because Christmas is around the corner, in England, here in the UK, Christmas is widely celebrated and respected. And therefore, this is the only time people tend to want to meet with their loved ones, families. People come from all over the world, to meet and enjoy Christmas. So I think the preparation and the worrying really is like, they want to celebrate Christmas, and they hope, the lockdowns won't actually be there to disturb such preparations. So that's what it is, really.
Yeah. France also instituting that ban against the UK. They've got their own reasons for that. But in a stroke of irony, we've seen commentary coming out of that country where people are saying that the UK is being, call it, punished for being able to, I guess, respond to the Omicron variant in ways through which they have. And I say it's ironic because the UK itself instituted travel bans on South Africa and several other Southern African countries after the discovery of this variant in this country. I mean, what's the sentiment around that? I mean, help us perhaps place the conversations around how specifically the government is responding to this ban, given the bans that the UK has placed on other countries.
You know, regardless of the political view, regardless of the public opinion and view in terms of, lockdowns, for example, in terms of movement restrictions, from the scientific point of view, restricting movement, lockdowns, encouraging all these sort of things that we have been talking about in the last, many months, really. It is a way to deal with the respiratory virus like COVID. So I'm not totally surprised when one country decide to say, well, the numbers are really going up in your country, and therefore we do not want to get people coming in. So, same as what Britain did. I think, Britain, obviously reacted. A lot of people thought it was knee-jerk reaction when they stopped South Africa or Southern African, travelers to come into the UK. You can see the situation now, regardless of that action that was taken by the UK, you actually see now the numbers in the UK, they are still going up. So sometimes it's a question of evaluating, whether, what is being done, the actions that are being done, are they being done timely, and do they have any effect? Do they work? But then, again, at the same time, it's easy for us to say all these things, but dealing with a pandemic, dealing with a virus like this is extremely difficult. In most cases, there's never going to be a right or wrong answer. It's just that there has to be a proper and real collaboration, and the politicians, in my view, in any country, regardless, the UK, any country in Africa, they have to listen to the scientists, because this is where the planning has to start.
Patrick Jolomba is a medical researcher and also a member of the Research Ethics Committee. Patrick, thanks very much indeed for your time. I appreciate it, sir.
Thanks a lot.
All right.